The Centers for Disease Control and Prevention also saying that people who have been fully vaccinated, meaning that they have gotten their 2 doses of the vaccine, can skip quarantining if they come in contact with someone who has the virus. This is a huge development. So joining us now to talk more about this new recommendation is Dr. Ogechika Alozie. He is the CEO of Sunset ID Care and a co-chair of the El Paso Coronavirus Task Force. Dr. Alozie, thank you for joining us this morning.
Good morning. Thanks for having me.
So do you believe that fully vaccinated people, the people who have gotten those 2 doses, should skip quarantining? Is this happening too soon?
You know what? I truly do believe, and this aligns with a lot of other experts and professionals out there, this is the right tone to take. I actually believe that the CDC in the United States is probably behind Europe in this. We've gotten so wrapped up in the fear and sort of doom and gloom of COVID that we don't want to take a win where we have it. Vaccines are an amazing development, and that's what they do. Reduce disease, potentially reduce transmission. We know that from both AstraZeneca and Moderna, and we know that from watching Israel and the fact that they've gotten so many people vaccinated, and you can start to see a reduction in transmission. So I think we need to give people that vaccine hope and not focus on the vaccine hesitancy, and this is great news.
Yeah, it is interesting that you talk about that fear because people are still very fearful of getting coronavirus even after getting vaccinated. But I do know with this new recommendation, there are stipulations when it comes to it. I saw that you have to have had the vaccine, the last dose, gotten your last dose, and then 2 weeks later, that's when you would begin to say if you were getting to contact with someone who had the coronavirus, you could do it from there, so you could not quarantine from there. Could you just talk more about that and how this isn't just like a cut and dry situation?
Yeah, absolutely. So I think people need to remember, right, that the vaccine is a series for a reason. There's the priming shot, which is number 1, and then there's the boosting shot, which is number 2. And what the data seems to show is that 2 weeks after, 14 days after your second shot with Moderna and with Pfizer, you're approximately 95% protected. And I think it's in that spirit, following the data and the science, that the CDC is making this recommendation. Also remember that that 95% is not just 95%, but 100% in terms of hospitalizations and death. And that's just not with Moderna and Pfizer. AstraZeneca has shown that. Novavax has shown that. Hopefully J&J coming on the market in the next 2 to 3 weeks after the FDA goes through their approval process will show the same thing. And so I think, a lot of times we get bogged down, well, it's 95%, it's not 100%. Day-to-day life has risk. Snowing here in El Paso, getting on the road in Dallas and Houston where it's snowing in Texas is a risk. We don't expect life to be a zero risk event, but I think it is critically important, and this is where we have to focus. Hospitalizations and deaths, the protection that these vaccines can give us, that's where we need to focus on, and that's where we need to lead. And so the message is nuanced. I think people can take nuance, and so I think people will do the right things, but the vaccine is the hope that they need.
And doctor, just because you get the vaccine, obviously we know, does not mean that you should stop taking precautions like wearing your mask, getting tested. Those are still important. So can you talk more about why it's still important to social distance and to wear your mask? I mean, I know that there's new recommendations out saying that maybe you should double mask. Just tell people out there what they still need to be doing even after they get vaccinated.
Yeah, great point. And so I think that here's the reality. If you have 2 or more people that have been vaccinated 14 days post their second shot, I truly do believe that they don't need to mask. That's the whole point of the vaccine. How, if you have somebody that's vaccinated and one that's unvaccinated, we don't know the full details, and so there will be more data to show clarity around that. And if you have 2 unvaccinated persons, absolutely, full social distancing, physical distancing, all the mitigation strategies that we've talked about throughout this pandemic are important. But again, these are all nuanced pieces, right? And so masking along with ventilation and distancing goes right in hand with the vaccination. And so everybody will have a different menu based on where they are on their vaccination course.
And just lastly here, Dr. Lozzi, trying to keep up with all these new recommendations and mandates can be a lot. I even know for me, we're getting new things every day. So what advice do you have for the people out there, the people who are listening to us right now, to just keep up with everything? How can they keep up with everything that's going on?
I think it's immensely important for news channels like this and others to identify trusted resources and then focus on the broader picture. I think what unfortunately has happened during the course of this pandemic is that because of the fear, we've broken everything into micro slices, and micro slices and the minutia are really hard to follow. I mean, that's what physicians and scientists and epidemiologists do all the time. That's not what the general public does. And so we need to start messaging a little bit differently. And I'd actually say messaging better. The European Union has hit it right, the nail on the head. And they're clearly saying they're vaccinating so they can get together with their families. They're vaccinating so they can improve their lives. And they're vaccinating for hope. And that has to be the message. And I understand the variants are coming and they may be predominant and people are worried. But we have to continue to focusing on that hope message and people being careful. But vaccines are the way out.
All right, Dr. Lozzi, thank you so much for taking the time to talk to us about this morning and just to talk more about that recommendation, because anything new can have people kind of on edge, like, okay, what does this mean? So thank you so much for explaining that for us.
Thank you. I appreciate it.